Hi, my name is John Thompson. I am one of the National Associate Clinical Directors at the Centre for Sustainable Delivery in NHS Scotland. Accelerated National Innovation Adoption, or ANIA, is a multi-organisation partnership between government and the NHS in Scotland. This partnership is coordinated by the Centre for Sustainable Delivery. ANIA is designed for a small number of key innovations that are proven technologies that are ready to scale across Scotland for the benefit of patients and staff and the country as a whole. The specific technologies can be very varied, and each value case is a bespoke assessment of the technology and how it impacts existing systems and workflows. Gentamicin gene testing. A person's genes can determine if they're at risk of a particular adverse reaction to a medication or not.
Hi, I'm Pete Constantino, a consultant clinical geneticist in NHS Greater Glasgow and Clyde, and I'd like to talk about a proposed innovation project for point-of-care targeted genetic testing in acute units. This rapid testing significantly outpaces conventional laboratory methods, offering timely and crucial intervention for an infant with suspected sepsis. By having this testing equipment in all neonatal units across Scotland, we can ensure that every newborn has the same protection, true equity of access.
So gentamicin is a common and effective antibiotic that we use here in the neonatal unit. It's really important to treat neonatal sepsis using antibiotics to improve survival. Unfortunately, gentamicin has the undesirable side effect of ototoxicity, or damage to the ear and the hearing system. Newborn infants are particularly susceptible due to their immature and still developing auditory systems and kidneys. Hearing loss as a baby can significantly impact on language development, communication skills and social interaction. Early interventions are available, and these are important, such as hearing aids, cochlear implants and specific educational programmes. We hope that by introducing a simple point-of-care test, there is the potential to avoid severe irreversible hearing loss while still treating neonatal sepsis effectively.
When introducing this point-of-care test into practice, we will develop robust prescribing steps to be followed in the event of a baby testing positive for the genetic variant, which will be clearly documented within our current guidance to mitigate any time delays in patients receiving their antibiotics. An alternative broader spectrum antibiotic will be prescribed, which will be equally comparable to gentamicin in terms of clinical efficacy against suspected organisms. This antibiotic is not routinely used first line in all babies to reduce the risk of antimicrobial resistance. We will be tailoring our prescribing to the individual requirements of each of our patients. Any baby who is found to carry this genetic variant will receive antibiotics which will effectively treat the suspected infection without resulting in any harm to their hearing. Patient care will not be compromised in any way.
The type of deafness that gentamicin causes is quite a severe to profound deafness, so these children can't benefit from conventional hearing aids, and they need to come down to the cochlear implant team for assessment and implantation. So it can leave a child who was born naturally hearing, with normal levels of hearing, it can leave them profoundly deaf. The first year that a child would be implanted, so taking into account their assessment, the operation and buying the little electrode array that goes into their inner ear, plus the outside equipment that they wear to actually help them to hear, plus all the checks and programming that we need to do at the hospital and all of the rehabilitation support, that costs upwards of £40,000 just for the first year. In terms of the cochlear implant, there's ongoing maintenance. We need to see these children intensively at the National Cochlear Implant Centre in Kilmarnock. So per year, you're looking at sort of around about £8,000 to £10,000 per child just to maintain their hearing levels. Every 5 years, we need to upgrade the outer equipment that you wear to help you listen, and that costs, each processor that the children wear costs about £6,000. Children always get bilateral cochlear implants if we're able to do that. So, that's a child with £12,000 worth of equipment that needs upgraded every 5 years. So there's certainly significant costs attached to cochlear implantation. to start off with for the operation and fitting the device, but also lifelong costs associated with maintaining and keeping the equipment up to date so that the person can hear.
Parents of these infants would receive genetic counselling, raising awareness and preventing hearing loss in other family members who might carry the gene variant. With support, we can make this vital service available nationwide, safeguarding newborns and supporting their families. Thank you for considering this important initiative.